Hi, my name is Khushie Shelat, and today I'm going to speak about a topic that I researched while I was a member of New York State Senator James Gordon's Youth Policy Cabinet. Marijuana is a controlled substance that has been in the media very frequently because of the wave of legislations legalizing its recreational use has been rapidly spreading across the United States. Since the abuse of the substance carries significant health risks, especially for adolescents and young adults, learning about its public health impact is extremely important. Before we begin our discussion, here's a little bit about myself. I'm a rising senior at Jericho High School in Long Island, New York. Over the last 3 years, I participated in research at several universities. At Rutgers, I had the wonderful opportunity to work with Professor Andrew Rezwan on genomic sequencing of Landotia punctata utilizing the BLAST-P and BLAST-N databases. This year, I'm working with researchers at the University of Massachusetts Amherst and the Department of Bioinformatics on studying the effects of long-term dietary exposure to tert-butylhydroquinone, or TBHQ, which is a synthetic food preservative. Like many of you, I have a strong interest in medicine. This led me to create and organize the Jericho Pre-Health Society, a club to allow students at my high school to explore their interests in healthcare by interacting with healthcare professionals. Since the restrictions placed by the pandemic resulted in school-sponsored extracurriculars to be canceled, I focused my efforts on helping my community deal with many of the challenges that resulted from the quarantine. From organizing appreciation lunches for 1,000 frontline healthcare workers at 10 hospitals on Long Island to helping senior citizens shop for their groceries. My efforts in helping my community introduced me to many elected officials and healthcare leaders. This slide is an overview of my presentation. I will be talking about some of the background of cannabis usage and the justification used to build support for recreational marijuana, the effects the legalization has had on the cannabis market, the adverse effects of cannabis and how they can impact public health, some of the data points that we can monitor to assess public health, and we'll end the discussion with some of the public health interventions that can be utilized. Just to give everyone some background about cannabis usage, cannabis is used by over 188 million adults worldwide. With such a large population of users, there has always been a push to legalize its use. In fact, in the United States, the grassroots efforts to legalize cannabis has been going on since the 1960s. These efforts ultimately resulted in citizen-initiated referendums that led to its legalization for medical use only in patients suffering from cancer. These limited use legislations allowed the public to become more familiar with cannabis, while also making it socially more acceptable. After all, it was being used to treat pain for patients suffering from cancer. This led to reduced opposition, and in 2012, Colorado and Washington became the first two states to legalize the recreational use of cannabis. But how did we exactly get to so many states accepting the legalization of cannabis? This had to do with the studies that came out stating the societal benefits of legalizing recreational cannabis. There were several studies that demonstrated that cannabis was less harmful than opioids, tobacco, and alcohol. There were many young adults whose lives were being destroyed because of the unnecessary criminal cases that were being filed because of the possession of cannabis. Many minority populations were being harshly affected by having criminal records for cannabis possession. Many state governments felt that legalizing cannabis would eliminate the illicit market and would also serve as an excellent source of tax revenue that could fund various programs. State legislators also felt that by legalizing recreational use, they could control how the cannabis plant was being grown and the THC content, thereby preventing many health complications, such as heavy metal poisoning. By having a better control of the supply and sales of cannabis, they could prevent adolescents from readily accessing cannabis. Finally, by legalizing cannabis, law enforcement can redirect its efforts at more serious crimes. This is a recently updated map that displays the legal status of recreational cannabis in various countries. Red means that it's illegal, pink means that it's illegal, but the law is not enforced regularly. Gold means that the use of cannabis has been decriminalized, and blue means that it's legal. In most of the world, cannabis remains illegal. In 2013, Uruguay was the first country to legalize recreational cannabis. And then in 2018, Canada became the second. Since cannabis remains illegal in most of the world and the data from countries where it is legal is sparse, determining the full impact on public health is going to take some time. In the United States, each state carries its own individual authority with regard to recreational cannabis use. The recreational use policy can vary dramatically even among neighboring states. Furthermore, because of such wide variations in the law, it often becomes difficult to effectively know the public health effects on individual state populations. What was the impact of legalizing cannabis? Due to the wide and legal availability of cannabis, the price plummeted. The diverse array of cannabis products with varying degrees of potency allowed for cannabis to become easily more socially acceptable. From the previous experience that public health researchers have had with alcohol and tobacco, the higher the potency and accessibility of a product, the faster the rate of new users, increasing the risk of adverse public health concerns. Cannabis can present short-term and long-term concerns. First, we'll talk about the short-term concerns. Having cannabis in the body reduces higher level brain functioning and increases reaction time. In regions where cannabis is legal, the raw data has demonstrated an increase in motor vehicle accidents linked to cannabis use. In 2016, a study sponsored by the World Health Organization noted that frequent cannabis use was associated with increased hospitalizations for mental health concerns, specifically acute psychological distress and psychosis. The same study also noted abnormalities of fetal development in pregnant women who use cannabis frequently during their pregnancy. When cannabis was legalized, it was believed that the use of other substances would decline. Based on the limited data that we have, some states have not noted the anticipated decrease in the use of other narcotics. This has led to some fear that the legalization of cannabis will increase the likelihood of polysubstance abuse. One of the biggest concerns of long-term use of cannabis is cannabis use disorder. Individuals who have intake of highly potent cannabis on a daily basis are likely to develop this condition. In this condition, individuals will usually report irritability, sleep difficulties, cravings, restlessness, and various forms of physical discomfort. Another major public health concern is associated with the use of cannabis among young adults and adolescents. Frequent use of cannabis in this population has been associated with poor educational achievement as a result of significant cognitive impairment. It has also been associated with increased impulsiveness and risk-taking behavior. With regard to psychiatric disorders seen with short-term use of cannabis, chronic use demonstrates that the earlier in age the use is started, the more likely the schizophreniform and psychosis will develop. Additionally, the likelihood of having the psychiatric disorder increases with increased duration and frequency of use. The higher the potency of the cannabis that is used, the more likely that psychiatric complications will develop. Many heavy users of cannabis also experience hyperemesis syndrome, in which they experience cyclic abdominal pain and vomiting, leading to fatal complications. Repeated vomiting can also trigger vasovagal syncope. Cannabis has not been linked to increased risk of pulmonary disease, but linked to cardiovascular disease in young smokers. In middle-aged cannabis users, there is an increased risk of myocardial infarction. Although it doesn't increase the risk of lung disease, it does cause an exacerbation of pre-existing lung disease, such as chronic obstructive pulmonary disease and asthma, because of increased coughing and wheezing. An increased risk of testicular cancer has been noted in high-frequency cannabis users and in those who have been using cannabis on a regular basis for over 10 years. Researchers usually turn to three sources when they want to obtain data about the use of controlled substances: the Monitoring the Future survey produced by the National Institute of Drug Abuse, the CDC's Youth Behavior Risk Surveillance, and the National Survey on Drug Use and Health that is conducted by the Substance Abuse and Mental Health Services Administration, which is a part of the U.S. Department of Health and Human Services. However, recently relying on the information provided by these surveys has been difficult because the pandemic has limited consistent data collection by all three of these surveys. Over the course of the pandemic, 3 states have legalized marijuana. With the changing laws, there will be less reliable data. Despite the limitations of our data, the physical and mental effects of cannabis abuse provided us with a good idea of what we should be monitoring. These include car crash fatalities and injuries from cannabis impaired drivers, the number of emergency department admission heart attacks and strokes in young adults, and the number of emergency department admissions for cyclic vomiting in young adults. Another good method of tracking the effects of cannabis use is to track the treatment-seeking behavior of adults and adolescents. It would also be useful to monitor the tobacco use in adult and adolescents, as the ready availability of cannabis may affect tobacco use, as cannabis use may affect as a reverse gateway drug to tobacco. Finally, it will be useful to track on the criminal penalties imposed on minorities, as one of the justifications for legalizing cannabis was to remove the unequal enforcement on minorities. While the full public health impact of legalizing marijuana will elude us for some time, this does not mean we cannot have a plan to help individuals who may fall victim to addiction and/or complications from cannabis use. Since adolescents and young adults are at increased risk from addiction, the Keep a Clear Mind program can be introduced in schools and utilized in partnership with parents. Using the health belief theory, the program educates both the young person and the parents about how cannabis affects the body. The program also utilizes the theory of planned behavior to open a conversation between the young person and the parents to help the young person understand how the parents feel about utilizing cannabis. Legalizing cannabis has introduced a new wrinkle in the fabric of public health and medicine that constantly aims to protect and preserve the health of society. In a society that is already fighting against other concerns such as gun violence and opioid addiction, the potential for exacerbating these issues through the use of cannabis requires close attention and further study. With some patience and some persistence, we will be able to properly evaluate the full public health impact of legalizing cannabis and come up with methods to mitigate any major public health concerns. Thank you for your interest in listening to this presentation. Please feel free to contact me if you have any questions at the email on the given slide. Here are all the references that I used.